Everyone is vulnerable to being pinned when life plays hardball, whether it is a physical or mental health condition. No one can stand alone. For those who are not pinned, appreciate that it could be you or loved one someday. So when you see a chance to help someone, please do. They are not weak, they are pinned. Even a slight hand up and a listening ear can begin seriously lightening the load, change, or save a life. Help end stigma. Move from being pinned to purpose. Time for a hand up.
Hello, everyone. It's Jeff Moore. I'm the founder and host of the Pin to Purpose podcast. And I'm very, very happy today to introduce you to Dr. Tarek Razek, who has had a very distinguished career in trauma, both at the Montreal General Hospital, in major organizations throughout Quebec and globally. And he was also the 2021 recipient of the prestigious Rock Robertson Chair in Surgery, recognizing his instrumental role in building one of Canada's leading trauma programs and his excellence in trauma education and systems development at McGill University. His bio is far too long for me to go into. I've just given really a tiny clip of it, but he has done and continues to do extremely important work around the world in trauma. So very, very pleased. And I've known Tarek for a very long time. Very, very happy he's joined us. And Tarek, why don't I pass it over to you? Because I don't think I've certainly done your background justice, but maybe you can tell people a bit more about the highlights of your work, and then we'll get into a broader discussion about Pin to Purpose.
Yeah, thanks so much. A very generous introduction there. I spent, trained in medicine at McGill, and then did my surgical training at McGill as well in general surgery, and then my fellowship in trauma, where I got interested in trauma surgery and trauma care and emergency services and disaster response type stuff at the University of Pennsylvania in Philadelphia, where I did my fellowship in trauma and in an intensive care medicine, and then came back a long time ago now in 1999, 2000. I can't believe that. And spent the last 23 plus years in a leadership capacity at the Montreal General Hospital at McGill, helping to continue to build the trauma program there, serving the city of Montreal, province of Quebec, as part of Canada, and build a team there from a small team to what became, I think, a very robust and very good team. Very proud of that. And I've since left that position now for the last 2 years. And I do now mostly focusing on helping other people achieve those same goals in their own environment of building really strong emergency response and trauma care systems and intensive care systems to respond to critical emergencies in their own communities, and train people to take on leadership roles to do that in their own communities, which is such an important public health need to be able to cope with events that occur in society and in communities to help prevent them and to help deal with them when they do occur. So that's what I do now. I work internationally helping teams develop that same capacity. So it's a privilege to do that work, actually.
No, that's tremendous. I wanted to ask you if we can go back a little bit to when you were in med school and you were first starting out and you were deciding what direction you wanted to take in the profession, and what led you to decide to go in this direction?
Yeah, it's a good question. You know, I deal with a lot of students and trainees over the course of my career, and it's something that's very difficult to intellectualize. You know, where are you going to travel the path that's going to come in front of you, and how do you decide what branches in that path to take as they present themselves to you as you advance in whatever it is that you're doing? And I think some of it is more an emotional response to what you're experiencing. You know, so you have these various experiences, and sort of just there's an intellectual component to it. Do I like this material? Do I like this type of stuff? But also it's about, do I like the community that's engaged in it? Do I feel a kinship? Do I feel like a family in a way of a sense of belonging or a sense of comfort in the teams that I'm doing the work with as I'm doing different things? And so I realized relatively quickly that it was in the surgical environment that I felt the most comfortable, that I felt the most relaxed with the teams I was working with. There's sort of a kinship there and a similarity of attitude. I was also introduced to it because my father worked as a surgeon when he immigrated here. He immigrated here from Egypt and retrained as a surgeon when he came here, and ended up working in his career as a surgeon in the Laurentians, which is an interesting story itself. And so I was exposed to it. So it was a bit of a familiar space. I'm sure that had an impact, although we honestly never discussed what I would do in my life in any meaningful way. Actually, he sort of really kept a hands-off approach to that, which is interesting. To signal of the times, I think, in some ways, and the nature of his work. I didn't see him all that often, to be honest, and so that's a byproduct of working in surgery in some ways. And yeah, but I'm sure that had an impact. And I think also, very interestingly, there's without a doubt in my mind, the television series MASH had a significant impact on me, without any question. I was completely engrossed in that when I was a kid. I loved the ethic of it. I loved the material that came up in the show, and the attitude of the actors and their approach to dealing with things. And it's fascinating to me how the arc of my career has ended up sort of somewhat mirroring some of the topics and issues and environments and realities that show explored, I think, in a very intelligent and thoughtful way. So I without a doubt, that had an impact on me, which is quite hilarious to reflect on, actually.
Right. I really enjoyed MASH as well. That was a tremendous show. I wanted to know, I mean, you're somebody who is intensely involved with the human condition, because you're helping people in extreme circumstances with surgery and with all of the different care that you've been providing and leading with your teams over the years. So we'll get gradually into that in this discussion, because for me, as you know, the very basic thing that I'm trying to emphasize is trying to help make a contribution by talking to people such as yourself and people with a wide array of experiences, to helping to eliminate stigma, and then by doing that, giving them a bit of a hand up on their healing journeys. And so the physical side seems to be, universally accepted, that society is, doesn't put stigma on people who need to have to seek care. But there is still stigma in different places and different cultures, et cetera, about mental health. So again, we'll get into that in a bit more detail. But as you started going through your career, I don't know if you can just give a few more examples, and the challenges and the wonderful work that you and your colleagues have done over the years in trauma care.
Yeah, it's so I think it's really interesting that construct of the stigma attached to certain illnesses, and how that affects the experience of having an issue of any kind. If there's a stigma attached to it, what that amplifies and how that impacts it. But I would also I would suggest that, yes, definitively, mental health has a significant and persistent issue in terms of how it's perceived, and then therefore a large impact on how that then interacts with everyone and who's experiencing it, never mind the individual, but everybody around that individual and society as a whole. But in my experience, and we can get into this later on, but in my experience, in certain aspects of physical illness, there's a similar degree of stigma attached to it that society layers. And it's certainly in the work that I did in emergency care and trauma, it's a focal point for some significant stigma. That's something that I've reflected on quite a bit. And I think the overlap between that and the stigma that's attached to mental health issues, which are often, unfortunately, linked to trauma and trauma events, that we would deal with. A large percentage of patients who had psychiatric diagnoses who would be suffering from trauma events as either part of or related to those illnesses. They're intertwined in some degree in terms of increasing risk. And so I think it's fascinating, and that aspect of how we socialize and how we think of some of these illnesses is absolutely fascinating to me, and something that I do reflect on quite a bit. Yeah, in terms of the work, I don't know if you, so I, it's work with some amazing people, and have struggled with them to build, to improve and to build a program of emergency services and trauma care in this neck of the woods, and it's quite a journey. Learned from a lot of mentors, like I think many people who travel a path. You are leaning on the people who came before you, and I think that I'm standing on the shoulders of many giants in my past who have led me down this, helped me to lead me down this path for my own journey. and that the people that helped me at McGill from before, and the individuals who I trained with, especially the group in Philadelphia at the University of Pennsylvania, who really showed me the ropes on doing this kind of work in a system that was already fairly mature, and how they navigated that, and how they approached it was really eye-opening. And to this day, I still lean on them from time to time to get advice and support in terms of where I'm at in my journey doing this as well. It's a very difficult path. I don't think, as you go through your training and you're sort of on railroad tracks and you're just steaming ahead, and it's not. I think with a lot of things, you're not always afforded the opportunity, and you're not always taught how to properly reflect on where you are in your journey and what's happening to you as you go along in your path. And I think I'm guilty of that. I think as I was going along this path, it was a very all-consuming path. It's a difficult journey to acquire the skill sets to do some of this work. And it's work that often happens. There's daytime work that's needed to sort of organize the infrastructure, teaching, training, administration, et cetera, of how these systems of care work and to build them. And then a lot of our clinical work, a lot of our emergency service care actually happens after hours. So it's in evenings, nights, weekends, holidays. It's an all-consuming endeavor in terms of the time commitment that can be there, depending on how big the team is that you're working with. And when I started doing this, the team was very small.
I find that. Sorry.
Go ahead.
I find that a fascinating point because, mental health challenges, obviously there's conditions, but the challenges, professions such as the medical profession and, other very challenging professions, caregivers, public safety people who are exposed to different trauma or the stresses you have, obviously that can create significant anxiety or depression, or, to be able to keep that pace. And so I just want to throw that out there because, to me, depending on what is happening in somebody's life, we're all human and everybody is exposed to mental health challenges. And then, a large part of the population are exposed to mental health conditions or have mental health conditions. So, as a doctor, all of your colleagues, I think, have to deal with that and have to manage their own, well-being and mental health.
Yeah, absolutely. I think it's the that couldn't be more correct. I think in terms of and I think that we, at least I can speak for myself, and I think many of my colleagues, that you're so engrossed in the work and it's so all-consuming that you don't notice what's happening to you as you're doing the work, or you're just so preoccupied with getting the work done, and that in itself is sort of completely consuming all of your mental capacity, all your space that you have available to you, and then and you're just trying to survive through it. It's very easy to lose sight of where you are on your journey inside yourself as you're doing this. And I think that, for me, that was definitely the case. This was doing the work that I did, very proud of it, very happy with it. It's a remarkable and very rewarding thing to do, to learn these skill sets and to then be able to deploy them to help people and to do technically very sometimes complex and very interesting work, cognitively very challenging and interesting work, making rapid fire decisions under the time pressure of a critical event that's evolving, in terms of someone having a life-threatening event going on in front of you, and then having to make certain series of decisions that then result in certain actions that you have to take, which require technical skills to do them well. Is a really stimulating and very challenging and rewarding context. However, you can imagine being in that gauntlet day after day after day after day is draining. It's fatiguing. It's exhausting. You see some things that I think many people don't see, and I think it's a privilege, the access that I have had to witness the human condition as it plays out, things that happen to people, what it means to be a human being and to be alive, and the things that can happen to us. And you witness a lot of these very dramatic things that happen to people, and then you have to intervene on them, and also, deal with sometimes relatives and family members who are, navigating this along with us in some ways. And so, and dealing with your team members, the nurses, the other physicians, the trainees in an academic setting, it's a lot, and it's a lot to process, and you have a limited amount of time to process it. So I think we oftentimes fail to process the part that's relative to ourselves. And I think, physicians, I think as a group, as an example, there are many other types of occupations that have a similar set of intensity levels and stressors. And I think it's probably similar for all of those kinds of endeavors. But we're known to be quite poor at looking after ourselves. Mm-hmm. And I think I've witnessed that in myself, and I've witnessed that in some of my colleagues as well.
It's ironic considering the work you're doing for others and saving lives, and
yes.
It's ironic. But I'd like to talk to you a bit about the concept of weakness, or one of the reasons that people feel that that it is what stigma is about, that others cast aspersions on people saying they're weak, and that people who are suffering with a challenge or a condition are loath to be perceived as weak. And just to give you an example, I mean, I think of playing rugby years ago and having a concussion, and so I was taken off the field. I had to be taken out of the game. Now, would somebody call me weak? I don't think so. I think they could call me, I'm in a weakened state, because I've been hit hard. And so one of the ways that I believe is an interesting way to frame it is that people who are kind of weighed down with mental health challenges or conditions are in a weakened state. But I'd like to turn it over to you for just observations on, perceptions of weakness, because I also believe, and you know this, a million times better than I would, but the people that you have helped, given the seriousness of their the surgery and different things, it would be completely normal if, in my opinion, I don't know, that if every single one of them goes through certain mental health challenges on their road to recovery.
Yeah, absolutely. The impact of having the kind of things that can happen to people happen. It just is it's a complete disruption in whatever people's lives normally are somewhat, can be quite stressful on a normal basis, in just a normal everyday existence, right? And we all know that just the normal daily things of, trying to live your life well, trying to raise a family, if that's what you're doing, whatever it might be, your job situation, personal family issues, finance, blah, blah. I mean, there's like a zillion stressors in a normal life. And then now you have that going on in your life, and you're walking across the street and you're hit by a car, and now your life is at risk, and you have serious injury, and this was completely unexpected and unplanned. And now your life is at risk, and that this is also having an impact on all the other people in your personal space, if and so that's having an impact on all of them as well. And so the challenges to deal with that, to recover from it, are dramatic, and then the risk profile of people who are going to suffer more from these kinds of events also usually means, you're at a higher risk in a more resource poor context. So the poor communities, because of the safety of their environments, because of the quality of life that they're able to manage, are by nature and statistically significantly exposed to more injury events. And that's really well documented. And so you're dealing with a community that by a large proportion already have enhanced stressors in their life. And now they're dealing with this dramatically increased context of trying to cope with this. And I think, as a medical profession, I don't know that we're as good as we should be at navigating. We're better than we used to be. I don't know that we're as good as we need to be in understanding and building systems that respond well to those needs, both more dramatically and maybe even more importantly on the prevention side, on understanding what is it that causes these increased risks or put these people in an increased risk scenario in terms of poverty issues. And that speaks to a broader public health issue that's very important and very clear. Working in trauma for many years, it's dramatic, and it's very sad to see the consequences of some of those contexts and what the results are for being exposed to higher risk for injury, as one example. And higher risk for having mental health issues as well. I mean, injury can happen to anybody, but it's disproportionate in terms of who it impacts because of the risk profile of your context, of how you have to live. And it's the same for mental health issues. They can happen to anybody, and they are both, unfortunately, are very common realities. Mental health issues are extremely common in our communities, and it's just part of the human condition in some ways, I would argue,
right.
and to varying degrees. And so how well can you cope and manage with that? How big are the stressors that are provoking those issues in you in the first place? These are all linked. And it goes all the way back to sort of our public health approach to these kinds of problems. And trauma and injury, sadly, is the number one cause of death for everyone under the age of 49 or 50. And it's the number 4 cause of all-cause death, and it's almost always completely preventable. These are events that never really need to actually occur. So that's very sad. And you see the precursors to these events happening disproportionately in certain communities, and that's very sad. And you see that the disproportionate impact. We saw this with COVID, right? So when COVID happened, it disproportionately affects certain segments of our society. Those who are vulnerable, those who are at risk for a variety of reasons that are, I think, quite well understood, are exposed to greater risk from a public health point of view from many illnesses. And those include infectious diseases, they include trauma and injury, and they include mental health as well. And failing to understand that and failing to address those root causes is unfortunate, and I think as a society we can do better.
Prevention is a fascinating topic, and it's interesting because the old saying, an ounce of prevention is worth a pound of cure. And in terms of public policy and spending, et cetera, I mean, a pound is 16 ounces. So when you can invest $1 to turn it into 16, no matter how long it takes, that's an incredible investment. So I see and I follow different initiatives in impact investing and something called the brain economy, which is really developing now, prioritizing brain health and brain skills for resilience and innovation. And so I think, it's a fascinating topic for another day, but, it is something that, given the value of prevention monetarily, but maybe, more importantly from, well-being for individuals, absolutely. It'd be fascinating if there's more inter or multidisciplinary approaches to maximizing both, the health of individuals in society and the financial opportunities for the public and private sectors and investors.
Absolutely. We tend to think on a short-term basis, I think, as humans, and short-term investment, short-term gain. We don't think as easily on the long-term side, which is, the flaw in most people's investment strategies. If as just one random example, but it's very true, right? So, I think if we looked more on the long-term returns on the upfront investments, we would do a lot better. But it's not natural human nature. It has to be taught, it has to be reinforced, it has to be educated. Right.
You brought up an interesting point too in terms of prevention and maybe how far along people are in their certain situations, right? And again, I use just one metaphor of being pinned, but I know we spoke about this before. People aren't necessarily taught to self-identify how far along they are. We're all dealing with issues every day, as you said, but at a certain point, it becomes very, very difficult. And so I don't, if you have any other comments on that in terms of that need or the possible benefits of teaching people to self-identify more for when it's, time to ask for a hand up and not feel, restricted by stigma.
Yeah, for sure. I can speak from my own personal experience, I think, and to say that, I went for many years being completely engrossed in what I was doing. It was just all consuming. And, I felt, that I needed to commit just an insane amount of time to the work that I was asked to do, that I enjoyed doing. So it's this irony of I really enjoy what I was doing, but it was itself slowly having this impact on me that I don't think I'd recognized. And I think because it kind of creeps up on you. And the fact that you're I would almost classify it as an intoxication. You're addicted to all the side effects of the work if you really enjoy it. So, I really enjoyed what I did. It was very self-reaffirming. It was very rewarding. There's a tremendous feedback loop on being able to contribute and do stuff, but at the same time, it's draining something from you. It's taking something away as you do this on a personal level, on a family level, at the least of which is just time. in terms of the commitment. There's much more than that happening in terms of the emotional drain. And I think then COVID, for me personally, COVID hit, and then that was like very dramatic, and it was quite a massive crisis that, it's hard to even reflect on that now and be lucid in how I'm trying to realize just how dramatic that was, especially in the early days, the first 6 months, the first year prior to us having vaccines. And the lack of initial understanding of what was going on and the tremendous impact on the system. We were running out of resources. We were starting to have to think about triaging critical resources. We were running out of ICU beds. We were running out of the basic resources to take care of people who had critical illness. And this was getting to a really thin line, and we were approaching it really quickly, and so that required a lot of very dramatic actions in terms of the healthcare system trying to cope and manage with this massive stressor on our system. And in the Canadian healthcare system, our system typically runs at actually I would argue over 100% capacity. It's overstretched at all times, where we don't have enough beds. There are people in hallways in the emergency departments wait times were already quite long. The delays to get some critical surgeries are already sort of at the edge of what would be acceptable. This is prior to COVID happening. Right, and you add this massive, insult to the system, and you're like, well, how do we cope? What do we do? So we were canceling surgeries. We weren't able to function at the normal level. We were, so it was really something else that lasted for about 3 to 3.5 years. And so, we were trying to scramble around and still provide critical services during all this period. And that really, I think, accentuated my own experience of being in the role that I was in for this long. And it sort of forced me to recognize that I was at the end of my rope in terms of being able to continue to do this intensity of work. It accelerated, I think, for sure, because of the intensity of it. But to me, at one point near the end of that experience, it was like, well, I think I'm done with this. I don't think I can continue to do this in the same way, the same level. I need to take some space for myself to recover from this and to recover from the impact of this on me over many, many years, and then hyper accelerated during this crisis period of something like this happening. I think that's typical, right? I think we don't recognize, in terms of whatever anyone is going through, I think that experience for me, I think it's a relatively common experience of we're not trained to be self-reflective in how what we're doing or whatever is happening around us is impacting us. And the changes can be somewhat incremental. And it's often the people around us who are noticing it a lot more than we are. And as you suggested, because of some of the stigma attached to these things, we are not self-aware or unwilling to be self-aware, certainly not trained or taught to think about these things as openly. And the people around us are also uncomfortable, unaware, not well versed, not well educated or trained or knowledgeable about these things because of the stigma attached to some of these things. And so then it remains a bit of a silent creep. And then the only time you notice it is like your analogy, I think, is really elegant in terms of just the weightlifting, something physical that we can all relate to. Is you're lifting a small amount of weights and you're pushing that bar up off your chest, and then but at some point you're not going to be able to lift it up anymore. You've reached your capacity, and that's it. You've pushed yourself to your limit, and everybody has that limit, and it depends on the amount of weight, and it depends how long you've been doing it for, right? And so Absolutely. I think we all get to that point, but we're often not self-aware of it as it's happening, because it's happening very gradually. Second rep, third rep, fourth rep, fifth rep, and then all of a sudden you're like, and then we only notice it when you can't get it off your chest, right? And it's actually a little bit hard to breathe, and then you need, and then what you need to get that, now you need help, right? Now you actually need help, and in that context, it's just supernatural and totally normal to ask for a spotter to come and help you get it off your chest and to relieve you from that pressure. We don't do that with mental health. We wait until it gets to the point where you can't breathe. And that's when you first notice, maybe something's off. And it's, and then what for me, it was asking people around me. It wasn't asking people around me. It was people around me finally saying, hey, I don't think you're okay. Angry all the time, drinking more than I used to drink. It's like things like this. And you're like, I need to take a breather. And I need to take, and it's funny how that plays out. And I think that's a very, very common experience.
And it's fascinating because at that point, some people may have seen that But the interesting thing is, like with this bench press analogy, if you saw a very large football player struggling with 45 pounds, and that's in the video, you'd think it's a joke. Like
Right.
it's a complete joke. They would never struggle. So if somebody looks at you and the career you've had, or they look at others who have achieved a lot in their careers, they'd say, he's fine, she's fine, they can handle it. They don't see that you're on the 75th rep or the 120th rep, or,
Right.
that the world is just like, you've been dealing with a lot. So there's
Yeah, I
so
think
much.
you're right.
Yeah.
I think you're totally right. I think everybody has, based on what you're coming into the situation with, right?
Right.
You're bringing a load with you from a variety of life experiences that are putting you in a place where you can tolerate only so many more reps.
Yes.
You've already burned through your reserves, or your, and depending on how much stress you're dealing with at the time for whatever else is going on, and then you layer something else on, and you can see how people have a different point where they can't lift it up anymore.
That's right.
And you're right, but even and people that are high achievers, this is what you'll commonly hear in terms of the consequences of having a mental health crisis. Is people go, I never suspected, I never thought, never knew, never.
Sure.
Well, that's an issue, right? We're not self-aware as an individual for ourselves, which would be, again, really good, powerful to have that insight, but very difficult to have that kind of insight into how what's incrementally happening, but also for your friends, colleagues, family members, etc., to sort of be a bit more and to have less stigma about this, having this more scheduled, regular, sort of open conversations about how is everything going.
Yes.
And you would think in sort of the circumstances for me, and reflecting on some of this, is like, you would think during some kind of the insanity of the crisis of a COVID pandemic, like a catastrophe of like literally biblical proportions happening in our community, like really crazy stuff going on. And that I don't remember one single time in any of our gatherings or meetings, anybody ever having a discussion about how is everybody doing.
Mm-hmm.
Not one single time.
Really? Well,
yeah.
Well, you're pointing towards solutions, which is fantastic. I want to go quickly to, during COVID, I guess isolation was very difficult for many people. My own kids, some of them, like so many kids who are in university or schools, they missed that social contact because it was all online. But as we both know, I mean, the elderly in society also, there's a lot of depression because of that isolation. And going back to your point, people with all types of careers who self-identified with their career, and then once they're out of it, they don't have that community anymore. They may, be challenging themselves to redefine who they are if they emphasize their role too much. All of that can create anxiety and depression and things. So, part of the thinking with the Pin to Purpose initiative is moving towards purpose. People who are getting unpinned and making sure that they are engaged. The number two is, you should never be doing this alone. And purpose is finding activities or being engaged in communities which are embracing you and your involvement. So I was just wondering if you have any comments on the concept of purpose and well-being.
Well, I think that's brilliant. I think that's really key component to increasing and maintaining resiliency, right? And I think it's a very powerful thing. And the Japanese have a term for this, and it relates to their philosophy of life that gives one purpose, gives one meaning, and that it's important to always have this. And I think, I could be wrong here, I think the word is ikigai.
Yes.
And it relates to having this purpose in life. And I think that it is a fundamentally important aspect of just being human and being healthy, mentally and physically, I think, and so I think, as you become, as you say, unpinned, I think that it's very important to make sure you still find a way to have something that drives you, some meaning or purpose that you're interested in, passionate about. It can be very it can be very simple things. And I think sometimes the simpler, the more powerful. Very, very simple things can be very, very meaningful. It's the simplest thing is maintaining a garden, literally, for some people, especially at older age extremes, growing a garden, a beautiful garden, and or reading a certain type of literature and educating yourself about things continuously, driving an increase in knowledge that you're passionate about, relationships, contributing to the community. I think these things, there are many. There's some very complex ones that are fascinating that I think I'm still trying to do at my age. But there are some very simple things that I think are really critical. Even and very small relationships. Like for me, it's just reconnecting, with my family. And reconnecting with sort of basic family relationships, and reconnecting with some of the very fundamental things that make me, that are not necessarily exclusively or directly related to what my previous job was. You can get very confused with who you are with what your role is in your work, for example, and they can overlap, and you can have a lot of your sense of meaning or purpose is related to your work, especially when you enjoy it a lot, and that's fine. But it's important that as you transition, that you reattach yourself to what you are as an individual, separate from your work. Because those are two somewhat separate, distinct things, and it's important not to get too conflated or too confused about what you are as in your role and what you are as an individual human being, separate from that. And it's remarkable how when I've transitioned my role, relatively recently, and it's very very fascinating to reflect on how quickly that role, it's a role someone else can do, and now someone else is doing it and doing it fairly well, and so that's, there you go. And so that role, that I'm not that role. That role was just something I did that gave me some purpose that I enjoyed, and it's wonderful, and I'm very happy with that. But then you transition away from it, you realize, oh, I'm not that. I'm me. It's a very fascinating transition.
It's a fascinating point, because everybody's self-care and well-being it has to be number one, because as you say, basically when somebody retires, somebody is replacing them, and or if somebody leaves, if it's a thriving enterprise or if it's a profession, somebody is replacing them. So but we're with ourselves 24/7, and we have one life, and we're the captain of our own ship. So
nobody's replacing you in your own personal journey in your life, right? That's yours and yours alone, which is a remarkably fascinating thing as an existence as a human being, right? Living your life. But the role you're in is not exclusive to that. It's part of it, right? But it's not the exclusive domain of it, right? And it's important to transition away from that. And hopefully you transition away from the role, and someone takes on, does it much better than you did. That's my ideal, right? The person that comes up from within our group and takes over the position has learned from me, and now is taking it on and able to develop and do it much better than I ever did. And you progress, and hopefully things have a progression over time. And the same for your personal journey. Hopefully I'm learning how to be me a little bit better as I continue on your little journey of life, with the hiccups that come along the way, and to accept that that's going to happen, right? You're gonna do things not the way you would like to do them from time to time, and learn from them, and then try to digest it and move on.
I did want to ask you a few questions on this podcast about your international work, and in war zones and with natural disasters, crises, and things like that. And from afar, because we've known each other for a long time, but we haven't had the chance to speak often over the years. But still, I've always had huge respect when I learned a little bit about that. For me, when I went to Togo when I was 20, that was a transformational experience, and it's always given me a reflection on being a global citizen, and the beauty of different cultures, and of course the challenges and complexities and the negative stuff as well. But you've done incredible work, and it's not even fair to be asking you to speak about it for a few minutes, because I think you could speak about it for hours and hours, I'm sure. But if you'd like to share with our listeners some a story or two, or anecdotes and observations, and tie it back a bit to the human condition and mental health.
Yeah, well, yeah, absolutely. I've been very privileged to have been able to get into an environment where I learned some skills and skill sets and some knowledge that I think I didn't understand how uncommon it was to have that opportunity to learn some of the things I did learn from the mentors that I did have, and then to recognize that this is a value in these international and these global contexts, and that the rest of there isn't the same degree of this in the rest of the world as easily accessible, was a real it's obvious, but it was an eye opener for me at the time many years ago. And I've been very fortunate to be able to work with some other mentors and colleagues who do international, humanitarian response work, and sort of the teams I have worked with have been some of the International Committee of the Red Cross and the emergency response units of the Federation of Red Cross and Red Crescent Societies. And so deploying for things like, for example, with a field hospital in their emergency response units to the Haitian earthquake, things like this. I've been in the South Sudan with the war surgery groups, with the ICRC, and those are it's a privilege again to have that exposure to the human condition and the reality in a global context and what people are experiencing and living through, and to participate with them with that in a very intimate way, in providing critical health care in a disaster situation where the infrastructure has been completely demolished. And in the Haitian earthquake, for example, quite a dramatic and tragic event. All of the infrastructure was lost. And so we work with these very, very well organized teams. It's this aspect of professionalizing disaster response, which is sort of something I'm interested in. And working with these teams, these are very professionally run disaster response organized field hospitals run by the Red Cross. And in collaboration with the host nation, you get invited in, and the umbrella of all the global national societies bring together their resources, which are pre-organized and pre-trained. And then they deploy on request of the local. So the Haitian Red Cross says, we've had a major disaster, we need help. And then they send a fact-finding team. They go and they evaluate things, and they say, we need the field hospital deployed. And so we get sent down, and you go down within a period of 72 hours when you're called, if you're able to go. And it's amazing because you work in a context that's this global support for humanity, right? That is not the way we hear about the world very often. And that's very unfortunate to me, the way the world is represented in the media that we see. It's not accurate at all. Right. So there's partial truths there, things that are going on in the world for sure, but that's not the majority of what the world is like. It's just not. Yeah. And so you see this, we come together with this field as a natural disaster, an earthquake in Haiti. The German and Finnish Red Cross put together their field hospital, which is a pre-organized field hospital deployment that everybody is cross-trained on from different national societies with different expertise, anesthesiologists, surgeons, emergency physicians, nurses of different specialties, logisticians, engineers for water and sanitation infrastructure, food delivery stuff. Like it's quite an infrastructure. It's deployed as a self-sufficient unit for the 3-month self-sufficiency capacity, which is amazing. And then you're there with an international team of humanitarian workers who are helping the local community deal with the loss of their entire healthcare infrastructure. All the hospitals are broken and fell down, and et cetera. And the people that work there are trying to survive, never mind try to do their work. And so, it's impossible for them to sustain normal healthcare infrastructure for emergency care, not necessarily related to the earthquake, although as much as possible, yes. But by the time we get there, the local teams will have had to deal with most of what happened. In the acute setting, we're there to replace the normal infrastructure of emergency capacity, dealing with obstetric emergencies, regular injuries and orthopedic injuries, and regular acute healthcare emergencies that they're not able to cope with because their healthcare infrastructure has been demolished. And so we're there just to supplant that. And then we worked with teams. There was a Syrian anesthetist and an Australian anesthetist. There was there's a Belgian obstetrician. There were Canadian nurses. There was myself. There was there were Israeli nurses working with the Syrian anesthetist, working with the Australian. It was remarkable. And you see the world coming together to support each other in a moment of crisis. Beautiful. Collaboratively. It is really a lovely thing to watch happen, and everybody was working together seamlessly. There were a bunch of Haitian OR nurses who were some of the best nurses I've ever worked with, who their hospital was demolished, and so they were working through the Haitian Red Cross and were seconded to us to work in the field hospital with us, and they were just brilliant. And so that was just lovely, and they would come to work every day with a big smile on their face and happy to be doing the work with us, and have that interesting experience for them in terms of the workplace context, working with different professionals from around the world. But at the same time, they've lost loved ones, their houses have been destroyed, their workplaces destroyed. Like, it was remarkable, the resiliency of these people to cope with that and come to work with a smile on their face was impressive. And so you develop this deep, much more deep you know, humanitarian philosophy of the way you see the world and the way you see different people in the world. It breaks down a lot of barriers very rapidly. And I wish more people could have that experience of working with people from around the world in contexts where not necessarily in a natural disaster, would be better if that never happened, but just working collaboratively together to support infrastructure. A lot of the other work I do, you know, responding to disasters and being deployed with war surgery teams is very intermittent, obviously. And it's a joyful thing to be able to do to help people in those situations as much as one can do in this context. But it's the work that I do mostly internationally is just helping places that are struggling to get to another level, to help their local leadership support the building of their own infrastructure from the lessons we've learned in an environment we have better infrastructure and more resources. So how do we take the lessons learned from our developed infrastructure here for certain things like emergency response systems and trauma systems, et cetera, where, you know, in Quebec, for example, our trauma system infrastructure has reduced death rates in my career, you know, and this is not me, this is the whole system, but helping participate in building that, we've reduced death rates from major trauma in the region around Montreal, for example, from 50% in 1993. So if you had a major trauma, your death rate would be around 1 in 2 chance of dying, 50% chance of death from a major trauma event by some, you know, objective ways we measure what a major trauma is. And to the last data that we have now, having implemented the kind of systems we have in place, these regional trauma systems where we all kind of work together more in an integrated fashion. It's a lot about the logistics of how we deliver healthcare, but also some of the expertise and training and how to manage these things specifically. The death rate now from 50% is about 5%. It's between
That's incredible.
Which is
incredible.
It's insane. And it's mostly about training and organization.
Wow.
And so that's what I do. I help people figure, well, how can we do something similar to that structural implementation of a healthcare design for this specific type of problem, a time-dependent emergency, which is not just trauma, it's a lot of things. But it's, you know, how do we implement that in another context? So we work with local leadership to help. They want to do this. They know about this. And they, well, how can we do this here? And we sort of collaborate globally. It's, you know, a different vision of a humanitarian interaction where we try to, well, how do we help other places in the world implement that kind of infrastructure? How can we work together to make that happen and make it happen more efficiently? So that's a lot of the work that I do, training other leadership to be able to do this a little more easily in their own context and take those steps forward. And to see the world in that context, some of the work we've done is I worked in Kigali for a few years, and you know, you meet I think there were, like, at the time there were something like 12 you know, certified surgeons in the nation of Rwanda. And you're like, it's a population of roughly 7-8 million at the time. And it's like, you know, you're like, that's like just insanity. Like, I thought my work was hard. Like, what in the heck, you know? And you're looking at these guys, some of them were trained in Germany. They were just remarkable human beings, super well trained, really, you know, really working hard to improve the infrastructure in their own environment, in their own country. For their own communities, you know, but how could they do all the clinical care, the research and academics to understand things better, to help build the system, the training to train the next generation of people to come after them, so there's more than 12 in the future, you know, et cetera. So how can they do? Well, it's a big struggle, obviously. It's like almost insurmountable conceptually. So, you know, to provide some support to help them do what they're trying to do, and to support them in their trajectory of trying to figure things out in their own environment, and just be supportive to that, to help with some mentorship, some, you know, collegial support, is really a wonderful thing to do. And you meet these people from all over the world. One of the last places I went to was we do this work now with a team in Kuala Lumpur, Malaysia, and there were these young surgeons. Almost all of them were women, and they were working in Java, and they were like coming to take this training course to upgrade their skills and learn how to do best practice, you know, in trauma surgical care is one of the things that we teach as part of the program. And it was just a joy to spend some time with them and to help them, you know, make sure what they're doing is sort of up to date, the best they can do with their context and resources, and to just collaborate with them to figure that out together in the training programs that we run with, and to train them to run the training programs for their next, you know, for the next teams that come along for them. It's just you just meet these people and you're like, the world is such a fascinating place. and such a gorgeous place. But if when you randomly turn on the TV, that's not what you get.
Right.
So
Absolutely. And are those programs through Code Blue, your organization, or this is through other organizations, or?
Yeah, this is through a professional society that I work with. It's the International Association for Trauma Surgery and Intensive Care, IATSIC, and that's a professional society. These are all sort of not-for-profit endeavors that we do, and they still need a lot of financial support. And they're not no cost. They're just not for profit. We're not making money for a third-party stockholder, but we need resources to run them. So it's fun. Yeah. So we run them through some professional societies. Some of the Code Blue stuff that I do work with some colleagues on is trying to find ways. There are places that can help, that can support some financing to help build that infrastructure. And so we try to do that with some environments that can do that, and then use the resources to help do it in places that don't have as much resources, so that we can run that as a not-for-profit structure as well. So collaborative combination of the two approaches.
We've covered a ton of ground, and I would love to speak for much longer, but I think we're going to wrap up soon. But I also wanted to speak to you. You've done so many things throughout your life, and I know that you've also worked with the Montreal Canadiens. So, the most storied hockey franchise in history, incredible athletes, incredible people. And so if you have any comments on that as well, I mean, I think athletes for sure, they are seeking to perform at the highest levels, which means keeping their well-being, not just their physical well-being, but their mental focus and their mental health in balanced and top form.
Yeah, no doubt. I was very privileged to work with the Montreal Canadiens for many, many years, and worked together with Dr. David Mulder, was one of my mentors at the Montreal Journal from the trauma program point of view, and also introduced me to supporting his work with the Montreal Canadiens as the little bit that I contributed as being part of that team. But yeah, it's a fascinating world. It was very interesting to be a fly on the wall of the environment of a professional sports team, and to see what they go through. And how challenging it is in that context. If you just think about the hours, the work, the travel, the intensity of what's going on, the scrutiny that is layered upon them for what they do. I mean, if I make a mistake, it's not replayed 25 times that evening on RDS or TSN. So it's like, it's just the scrutiny, and these are often quite young kids. They're 18 to 25 years old. The majority of them, it's quite something. So it's very intense, and I think there's all sorts of layers of the stressors and the reality of that context, which are fascinating. One of them, though, is like one of the things is like that myth of talent that there is, like the people that were the highest performers. I remember watching Alex Kovalev played with them when I was there, and to watch his work ethic and to watch his training regimen was something else. Like those skills didn't come out of nowhere. They didn't just exist, out of the clear blue sky. The amount of dedication and work that goes into maintaining and developing those skills is almost shocking. It's really, really something to watch. That so the work that goes into maintaining that physical capacity and those technical skills that they have. And this I think works for any human endeavor. It's the same thing in music, for example. It's the same thing. People that play, musical instruments at a high level, people that work at the Philharmonics of the world, etc. The amount of dedication that goes into that is remarkable. That part of the human, and it drives a bit of that what we were talking about earlier about sort of purpose in life. You have something that drives you, but at the same token, you need to be very careful what's happening to you while you're driven to do these kinds of initiatives, and the amount of work that was in there. And I think that's where there's so much room for us to improve as a society in being much more self-reflective on what is happening to us as we engage in our path of achieving excellence or expertise or whatever it is that drives us, that's rewarded in society, right? But to be much more careful. And I think the younger generation is a lot better at this. I think we've gotten much better at this, but I think there's a long way to go in becoming more sophisticated in how we are more self-reflective about what our own experiences and our personal journey, and retaining that sense of self separate from role. And paying attention to what's happening to yourself and what's happening to you as you gauge upon that, and being careful to take care of yourself and maintain yourself while you're doing whatever it is you're doing. to achieve your degree of excellence that you would like to achieve. It's very challenging, and I don't think we have it right at the moment. I don't think we're as good as we need to be, and I think there's a large scope of room for improvement in how we do that.
Well, we've covered a ton of ground, and it's been a great pleasure to talk to you today, Tarek. I just want to invite you, if there's any other final points that you wanted to bring up that we haven't touched on, or if there's any other observation for people who are feeling a bit pinned and are hopefully trying to not have stigma holding them back, but reach out and to someone that they do trust. You don't have to tell the world about your personal issues. That is private. But so just for, if there's any other final comments on any topics, or if there's any other final points you want to make.
Yeah, I think just thanks for the invitation to speak with you today. I think it's such an important topic, because it's something that's relevant and important. I think every single human being, like, there's just no one escapes this experience, this reality of trying to navigate your life, and I think I think one thing I would say to people is that, I for myself, I didn't think that things could affect me the way that they have, the way that they did. And I was very lucky to sort of, I would say, at the very last minute, sort of recognize that, I need to take care of myself. I need to watch this. And I think that, so one message is an obvious one, I think, but it still bears repeating. It can happen to everybody is going to be impacted by this, by life circumstances. And you have to just be self-aware. And it's a natural thing. Like, it's a normal thing to be impacted by your life experiences, and so it should therefore be a very normal thing to take the time to be a bit self-reflective on where are you in that journey and how is it going, and that's one aspect of that. It's an extraordinarily normal experience to struggle with your life experience. It's just part of the life experience, and to try to navigate that a little bit more self-awareness. And then that's about yourself, but also about the people around you. So the people around you, some of whom you may never imagine, like you said about the huge bodybuilder who's struggling with his 45-pound weights, but maybe he's on his 150th rep, and he may need, at this point, he may need a spotter. He may need some help getting that off his chest. And so I think the same goes for everyone else with their mental health. I think be careful of the people around you, the people that you care about. Every once in a while, I think what's interesting to me is, yes, there is a lot of stigmata around these issues, but I think it's not as intense as one might think necessarily, especially around the people that you trust or love or know well, even in the workplace. I think if you mention things, the stigmata starts to melt away. If you ask simple, respectful questions or open it up in a self-reflective manner, I think people are very receptive to that, because everybody's having probably a very similar experience, and I think it's a shared experience. And I think once we understand how much of a shared experience this is, it's like when I go around the world and meet people from around the world who are doing similar work to what I was doing. Shockingly, they're having a similar experience, and that should not have been shocking. Why was that shocking to me? It doesn't make any sense. Why would I not have recognized that? Yeah, people in Rwanda and in Kuala Lumpur and in Chicago and in Montreal and in Berlin are having a similar experience doing the same work that I do, because they're doing the same work that I do. And it's the same thing. Everybody's living their lives, and everybody is a human being. And so there's a lot of similar and shared experiences. So I think once you open that up, even a tiny bit, I think the initial feeling of reluctance or the discomfort, it melts away. So I think to have the courage to just explore that gently, and I think you'll be shocked at how much more easy it is than one thinks. And how much more of a shared experience it is, and that helps a ton to recognize how much of a shared experience it is.
Wonderful thoughts. Thanks, Tarek, for joining today's Pin to Purpose podcast. It was really a great pleasure. Appreciate it.
Yeah, thanks a lot. Really appreciate it, Jeff.
Take care.
Thanks.